Hello. On behalf of the Education Committee for the Society for Simulation in Healthcare, it is my privilege to welcome you to the Certified Healthcare Simulation Educator course. This course was designed by the CHSE advisory team, and it is my honor to welcome you to this exciting course. My name is Heather Ann Noland, and I am the Clinical Simulation Outcomes Specialist for Centra Health in Lynchburg, Virginia. I have been involved in healthcare simulation for over 11 years, have been certified since 2016, and secured my advanced certification in 2022. As a healthcare simulation educator, I have experience in clinical and academic settings, specializing in simulation curriculum development, integrating best practice principles into simulation activity design, and promoting professional development in simulation. All images throughout this presentation are royalty-free from clip art, Pixabay, or permission granted by the organization. Let's begin by looking at the CHSE blueprint, starting in Domain 1, focusing on the professional values, capability, and leadership that a simulation educator should possess. Domain 1 is all about the simulation educator's personal journey. While many of these concepts will be revisited multiple times throughout our course, please remember to frame your view of these concepts appropriately. Let's start by looking at those professional values of the simulation educator. A simulation educator's passion should be evident. A certified healthcare simulation educator should love to share about this exciting field and seek opportunities to implement healthcare simulation-based education. Places where you should advocate for simulation-based education can begin internally within your organization, externally within your community, then broadening the reach to regional and state and government, and even national and international. You should be regarded as a simulation role model. Your dedication to service and leadership through simulation organizations like SSH and NACSL, etc., is extremely important. As a simulation educator, you will advocate for robust, experiential educational activities where you will design, develop, deliver, and evaluate simulation education. You will also mentor and coach learners, peers, recognizing opportunities where you may advocate for simulation pedagogy, standards of best practice, and the acquisition and allocation of simulation resources. At the forefront of every simulation activity design, you should seek to make connections to patient safety initiatives. As simulation educators, we must consider how legal, ethical, and regulatory guidelines apply to our simulation-based education. Regulatory guidelines and requirements developed by governmental organizations or supervisory agencies can impact academic and healthcare institutions that incorporate simulation. These guidelines and requirements are in place to outline safety procedures and requirements associated with the use and delivery of simulation-based education. Depending upon where you find yourself working as a CHSE, there are legal guidelines that you must be aware of and ensure you uphold the corresponding principles. For example, HIPAA, or the Health Insurance Portability and Accountability Act, outlines rules that apply to the handling of protected health information. When designing simulation activities that may relate to an actual patient experience or perhaps to a patient safety event, it is important to safeguard patient information. Another example of legal principles in the academic setting can be found in the Family Educational Rights and Privacy Act, or FERPA. Educators must safeguard student education records and include rules to protect student information when utilizing simulation. Both legal examples have implications for learners, and we should have certain expectations of confidentiality within the simulation environment. A few examples of international regulations are shown below the U.S. equivalent. It is important for you as a simulation educator to know, understand, and uphold these principles. There are ethical principles that must always be evident in your practice. We will look at 4 principles that surround this topic. Beneficence is the idea that the educator will act to design, create, and implement simulation with the best intent for the learner. You will model professional behavior, setting the example for all participants. In addition, you will honor privacy rights such as confidentiality, uphold HIPAA and FERPA standards. You will seek to create an ethical environment where the professional practice standards and institutional policies and procedures are adhered to in your practice. Justice is the principle that upholds fair, equitable, and appropriate treatment of the learners, honoring their backgrounds, training area of discipline, and ensuring fairness when providing simulation-based education. A simple example of this is to ensure access to the distribution of sim resources, such as scheduling and equipment requests. Autonomy is the principle that all participants have intrinsic and unconditional worth and should be allowed to exercise self-determination. It is important to pay attention to the feelings, wishes, and the rights of all participants. This can be achieved by providing consents and waivers that ensure respect for all. A CHSE is important to be proactive to preserve psychological safety. This is essential to maintain a respectful environment throughout, allowing participants the freedom to express ideas. It also allows for the assurance of confidentiality and the ability to provide constructive feedback. Non-maleficence is the principle avoiding or minimizing harm to participants. This is often expressed as the do no harm principle. To uphold this principle, it is important to include accurate references when building cases. Furthermore, this relates to making attempts to reduce physical and psychological harm throughout simulation activities. Seeing each activity as an opportunity for growth instead of personal or professional attack. Mutual respect and effective communication are essential in the delivery of simulation best practices. A CHSE must remember that these 4 principles apply to all participants, fellow educators, learners, patients, or others. Think of some unintended observers that might witness an in situ simulation or group tours going through simulation centers. Regulatory principles for simulation-based education can originate from various levels of government and/or professional organizations and regulating bodies. They can be international, national, regional, or even local. Safety standards published by organizations such as OSHA, CMS, the Joint Commission, or the National Institutes of Health should be upheld. An example of this applies to the use of simulation for bioskills. Ensuring the correct disposal of tissues and organs, using butcher-grade products, or properly handling sharp objects is important to keep in mind when developing this type of simulation activity. Become familiar with and incorporate validated and established standards of best practice in healthcare simulation is incredibly important. Ensuring that you uphold professional credentialing requirements and professional licensures is also key. Furthermore, adhering to SSH accreditation, certification, and the maintenance of that certification will ensure that you are congruent with regulatory principles. When reflecting on this topic, please consider what regulatory principles exist in your work setting. As simulation educators, we are to actively evaluate the potential for the physical and psychological risk for all participants. This would include teammates, educators, learners, and unintended observers such as patients and staff not participating in the event. Physical risks address the potential for an unintended physical harm in a simulation activity. It is important to think about opportunities such as hanging cords that might become a trip hazard, safe use for defibrillators, eliminating electrical hazards associated with their use, and infection control for SPs and bioskills labs. These are just some examples of the potential risks that are associated with creating realistic and engaging simulation activities. Psychological risks address the potential for unintended emotional stress, strain, or interpersonal problems that arise in simulation activities. We must anticipate triggers, plan for difficult debriefs, and ensure breaks for SPs when portraying challenging roles, such as receiving notice of a fatal illness or demonstrating the features of a behavioral health illness. Understanding these inherent and potential risks and developing contingency plans is a necessary aspect of your role as a simulation educator. For those who may not be familiar with the term bioskills, bioskills describes the practice of simulating a medical environment for the education of healthcare professionals for teaching, studying, training, or researching the gross structure of the human body or performing medical or surgical procedures. Bioskills replicates the patient experience through the use of human or animal anatomical specimens, medical simulators, or synthetic models. One of the strongest tenets as simulation educators is the respect with which learners will be treated when engaged in the learning environment. According to the Healthcare Simulation Dictionary, 2nd edition, psychological safety relates to a feeling, whether implicit or explicit, within a sim-based activity that participants are comfortable participating, speaking up, sharing thoughts, and asking for help as needed without concern for retribution or embarrassment. This also relates to the perception of the members of the team that it is safe to take risks, make mistakes, and those would be considered opportunities rather than being embarrassed or have punitive consequences. When creating a psychologically safe environment, it is important to remember that this allows learners to understand the risks associated with participating in the simulation activity. It also apprises learners of potential triggers. It informs the learner of the scenario format, whether or not they will be dealing with a death, a patient safety error, or other examples. It allows mistakes to occur with no harm to the learner. When creating a physical and psychologically safe learning environment, it is important to include a well-developed orientation and pre-brief. Looking closer at this slide, we will differentiate between the orientation and pre-brief phase of the activity. Let's look at orientation. This relates to information provided to familiarize the learners with the simulation activity or the learning environment itself. This may include resources that are available, the timing of the activity, and instruction on how the modality works. The intent is to prepare the participants before the simulation activity. Let's look at pre-brief or briefing. This relates to information that's provided before the simulation activity, which may include instructions or preparatory information. It may also include the assignment of roles, sharing background information on the patient, and assignments that need to be completed to prepare for the activity. The intent is to set the stage for the scenario and assist the participants in meeting the objectives. The best tool in our belt for psychological safety is our pre-brief. There are certain features that should be incorporated into every pre-brief, such as reviewing the expectations for participants, covering the simulation objectives, and the resources that will be made available to allow the learner to be successful. And there are others that will be added in specific situations, such as defibrillator precautions, the use of a task trainer in a hybrid scenario, or how to interact with SPs or embedded nurses. In addition to the list that you'll see on this slide, other concepts that may be included are explaining the flow of the event, describing those resources, tools, and instruments that are available to the learners, including what the learner expectations should be, and allowing time for questions. We will now shift our focus to fostering relationships with individuals and the community, both healthcare and global. This is critical for simulation educators. This ability not only promotes simulation-based education, but mentors teammates and learners alike. Cultivating relationships allows us to collaborate with key stakeholders or customers and those involved in simulation experiences. It will be important for you to develop your own list of relationships to target that is more specific to your role in simulation. The relationships may vary and may include things such as facilitator or faculty professional development, coaching, and mentorship of others. It is important to remember when working with subject matter experts that they are there for clinical content and you are there to guide simulation best practices. This mentorship and modeling ensures a safe learning environment for our participants. It is important to think about the educational or clinical systems when integrating simulation activities. This might include bidirectional communication with patient safety and others involved in strategic system priorities. You may find it beneficial to participate in memberships with simulation organizations to support this process. We should also be collaborating extensively with the experts inside our own simulation team. Here are some examples of simulation-based team members. Collaboration, mutual respect, and clear roles are keys for success. Let's further explore teammate roles and responsibilities. On this slide, you will see a simulation program exemplar. The roles and responsibilities will vary depending upon the simulation program or center. Please note that if you are a small program or a one-person shop, these are the roles that you can plan for. In a simulation program, there should be a leadership team. Simulation leadership might include a director and a manager. Let's take a look at the individual roles represented here. A director typically occupies the administrative and budgetary role, strategic oversight of operations and the running of the Sim Center. For example, they oversee the strategic plan development, operational budget, and financial responsibilities like capital purchasing and annual reporting. Simulation managers are responsible for the day-to-day operations, scheduling, and management of the simulation team. For example, they might oversee inventory, supplies, functioning of equipment, and scenario development. Simulation operations encompasses those who have an operational function. This role relates to the team member whose primary role is in the implementation and delivery of the sim activity. This is an inclusive umbrella term that embodies many different titles such as simulation technician, simulation specialist, or simulation coordinator. Simulation education relates to the educational team or other educators. Keep in mind that this course focuses on the simulation educator's role and responsibility and how the educator interacts with the team. Let's take a closer look at the role of the simulation educator or facilitator. This role encompasses the implementation of the simulation activity, offering assistance, guidance, or supervision. Their primary responsibility is to accomplish the intended outcome by enhancing learning, adhering to best practice principles, and improving communication. They often will take on the role of facilitating and debriefing the simulation activity. Simulation operations specialists are also involved in the implementation and delivery of the simulation activity. They are responsible for running the technology, performing preventative maintenance, preparing moulage, setting up and taking down the simulation activities. They oversee and ensure that the simulation technology is running smoothly and seamlessly. Let's take a look at another role, the embedded participant. This role is in on the simulation and is utilized to keep the scenario running smoothly. They help to foster realism by relaying key information, such as a change in the patient's condition or pointing out something that the learners might have missed. This role is scripted in the scenario. They also can help to troubleshoot challenges by pointing out equipment or helping the learners troubleshoot within the scenario. They can take on a role of a nurse, a family member, or another member of the healthcare team. This role is scripted, trained, and helps to further the scenario, not to intentionally distract the learner. A best practice principle is to have people unfamiliar to the learners play these roles. The term standardized patient and simulated patient, better known as the abbreviation SP, are often used interchangeably and refer to the person that is trained to portray a patient in a realistic and repeatable way. The SPs interact with the learners, allowing for an enhanced experiential education or assessment of the learners. This role is scripted into the simulation scenario, and the recruited SP is trained on their performance. SPs can also be educated on how to provide learner feedback, offering key insights from the perspective of the person they are trained to portray. It is encouraged to use people who are unfamiliar to the learner to play these roles. When utilizing SPs, it is important to understand and include the standards of best practice promoted by the Association of Standardized Patient Educators, or ASPE. These standards can be found on their website or in the Advances in Simulation publication. The role and target of our simulation is the participant or learner. This is the person who engages in the simulation activity for the purpose of gaining knowledge, mastery of skills, improving or demonstrating attitudes of professional practice, or participating in research. Now we will move on to discuss diversity, equity, and inclusion as it pertains to the simulation educator. According to the APA, equity, diversity, and inclusion, EDI, is a conceptual framework that promotes the fair treatment and full participation of all people, especially populations that have been historically underrepresented or subject to discrimination because of their background, identity, or disability. The concepts of DEI fit very neatly into our ethical principles and relationship building initiatives. It is important to think about the relationships that we should be fostering within our team and professional relationships as well. When creating new content, be strategic about reaching out to the community and developing opportunities that can be offered through your simulation program to the benefit of others. We should be intentional about collaborating with others to keep different points of view. Keep in mind the importance of both psychological safety and the impact on our patient community. Please note that the KSA is about the respect with which we treat our teammates, collaborators, participants, and the educational content. It is in no way meant to prescribe what content to include in your simulation-based education. Hand in hand with DEI is the newly published Healthcare Simulationist Code of Ethics. In 2018, a work group comprised of experts across all simulation professional organizations collaborated to create the Code of Ethics. This document is one of the resources that was presented to you at the beginning of this domain and can be used as a reference to support your practice. In this section, we discuss the potential members of the simulation team and the use of ethical principles and DEI that can enhance working relationships. It is important to model and encourage collaboration among your simulation team. It is also important to flatten any hierarchy among your team and when approaching others. Use lots of we statements. Providing team members with role clarity, establishing role assignments, and ensuring proper orientation of team members can provide for enhanced collaboration. It is important to have clear expectations and also to appreciate the expertise each member brings to each simulation activity. When necessary, be sure to resolve conflicts quickly while fostering mutual respect for all members. Now let's move on to the certain skills and abilities that sim educators need to create accurate and meaningful events. Let's discuss the global abilities needed by educators to ensure the accuracy of simulation-based education. We will begin with scenario content. It is important to use credible resources when developing scenarios. There are some commonly used credible sites on this slide for you to use as a resource. As a simulation educator, it is important to keep in mind that we are no longer the experts on the content for scenario development. We are to function as the expert simulationist. When reviewing resources, it is important to ask these questions on the left-hand side of this slide. Additional questions may include, how do you confirm content accuracy? What is your process for scenario development? How do you vet the content? Who are your resources? Do you have subject matter experts or content experts? Are there other educators on your team? Do you have access to a medical or surgical director? And how well do you know the subject matter expert knows what they know? It is important to verify each resource prior to implementing the activity. There are many variables to consider when determining credible resources. This slide and the next will review the criteria an educator can use to evaluate scenario resources such as journal articles, websites, and other publications. It is important to consider the author of the resource and examine if there are any biases within the resource itself. It is necessary to ensure that the content is current and relevant to current practices. Ask yourself if the resource established reliability or validity. Furthermore, look at the citations and list of references and determine that they are credible and current. When using online resources, ask yourself if the design and purpose of the resource is obvious. And then ensure that you understand the difference between the source sites, appreciating the difference between commercial, governmental, educational, and organizational groups. Regardless of the source, it is necessary that you ensure that the content is valid and free from potential biases or opinions. There are concepts related to research that simulation educators should be familiar with. Conducting research in simulation is essential to move the field of simulation forward. Research requires the individual to follow ethical and standard procedures to assure the validity and reliability of the data that is produced. Scholarship in research helps to increase the visibility of simulation across the continuum. Simulation educators need to become familiar with research and the methodologies that are specific to their environment. We will rarely lead the investigation, but we must understand the certain concepts to be able to communicate and be a part of the team that constructs and implements the research itself. Understanding quantitative research versus qualitative research is one of the basic elements for which we are responsible. Quantitative research features objective data that is associated with fact discovery. It has fixed and measurable data points that are analyzed by comparison and statistical analysis. On the other hand, qualitative research methodologies focus on the subjective data and understanding the behavior of the participants. This data is collected and analyzed in themes. It is important to note that the methodologies can be blended or mixed to allow for the integration of both types of research for enhanced effect. Researchers are held to the same ethical accountabilities that we discussed earlier. The elements of ethics in research are related to the concepts of beneficence, non-maleficence, autonomy, and justice. Some organizations may require you to complete some level of training prior to being a part of research. An example of this is the CITI or Collaborative Institute Training Initiative modules. Examples of these modules are focused on ethics, research, and meeting regulatory requirements. When involved in simulation-based research, it is important for the simulation educator to follow institutional guidelines and IRB instructions when obtaining informed consent. You need to know the 4 principles involved in the process of obtaining consent from your participants. It is important to describe the intervention or activity in detail, emphasizing the participant's role in the decision-making process. Additionally, it is important to discuss potential alternatives and disclose the potential risks involved in their participation. We mentioned earlier the concept of reliability when we talked about using credible resources. This concept also applies to our understanding of simulation-based research. Simulation educators need to understand the different types of reliability. Inter-rater reliability focuses on the agreement between 2 or more raters involved in the simulation activity assessment. Inter-rater reliability seeks to quantify the proximity of assessment scores between different raters. In essence, the more scores are similar, the greater the reliability of the data is assumed. Another type of reliability is intra-rater reliability, which focuses on the consistency of one rater over time. The focus of this reliability is on assigning the same value with the same rater rating the same variable over some time. This is the retest reliability, in which the same rater rates the same subject using the same scale or instruments at different time. These concepts of reliability are ones that you as an educator need to become familiar. As simulation educators, we are accountable for simulation-based educational outcomes and need to be able to evaluate the value of the educational activity. It is important to have a process that outlines how to correct or further develop each simulation activity. Additionally, it is important to tie these outcomes to the larger healthcare delivery system. On this slide, you will see the definition of quality improvement from the Defining Excellence textbook resource mentioned at the beginning of this course. It is important that you have a clearly defined and continual process for improvement. Some questions that will help to define this process are: how are you evaluating your program, scenario, learner experience, and process? What is the expected outcome for each of these and the best way to measure those outcomes? What surveys, checklists, and process improvement tools are you currently using? How are you collecting, organizing, and analyzing the data? There are a variety of tools and instruments available to use depending upon the focus area of improvement. Once the data is collected, what will you do with the data, and who needs to hear about these outcomes? Simulation programs need quality management systems to ensure they meet the needs of their customers and identify the outcomes of the simulation activities. Simulation educators must understand these elements of quality improvement. Please reference the terms and examples provided on this slide. An example of a process improvement method is provided on this slide. The PDSA, or Plan, Do, Study, Act model, outlines a 4-step and continual process used to improve simulation activities. Many of you may be familiar with this model. When an opportunity has been identified to improve an existing or a new activity or process, it is important to plan how you will improve. Then you want to initiate the plan and study or check to see if the plan worked. Then you must act or correct to improve the activity or process if it did not work. You will notice that this is a continual process until quality is ensured. An example of this might look like a simulation modality continuously fails in the middle of a simulation activity. It is important to determine the cause of the failure, then develop a plan to improve the activity so that the learners can achieve the intended objectives. After the plan is implemented, it is crucial to see if the plan worked. If not, you must act to correct or further improve your plan. Other examples of quality improvement methods include the continuous quality improvement, or CQI, and program evaluation. Each method should be further investigated to determine its usability for your program. There are several methods, and SSH does not promote one over the other, but does encourage that there needs to be a process of improvement in place. Thank you so much for spending time with me reviewing Domain 1, the professional values, capabilities, and leadership of a simulation educator. I am confident that you will enjoy future modules with my colleagues. I am excited that you have chosen to learn more about what it takes to become a simulation educator. Take care.